Welcome to the Healthy Habits podcast. In this episode, I am talking with a psychiatrist, Dr. Joan Obiols, and a psychologist, Marta Martin. Dr. Joan Obiols is the founder of Clínica Synaptica in Barcelona, Spain, a place which offers professional treatment and therapies with use of psychedelic substances. Dr. Obiols has decades of experience working with psychedelics, and he is one of the first to promote the use of ketamine in treatment of various mental conditions. Marta is a psychologist who graduated in psychology at the University of Edinburgh and then decided to orient her career towards working with ketamine-based therapy. Today, she is working at Clínica Synaptica, leading psychotherapeutic sessions with use of ketamine, so far the only legal psychedelic. Dr. Obiols and Marta share their private experiences with psychedelics and talk about the history and the taboo which surrounds this topic. In today's episode, we discuss the potential of psychedelics in medicine, but also the potential of their use in healthy individuals as a conscious practice that may help us all become better humans. Brace yourselves for a fascinating story of psychedelics with Marta Martin and Dr. Joan Obiols. Enjoy and tune in with Healthy Habits Podcast. Hello and welcome in the Healthy Habits podcast. I'm very happy that you accepted my invitation and that you want to be a part of our initiative. In particular, I think it's really nice that you agreed to meet me because I do think that talking about issues related to mental well-being and mental health is very important. And I think it's especially interesting to talk about them from your perspective, as you're someone who works with mental health, but with use of psychedelic drugs and other substances. So I'm really excited to have this conversation with you. Perhaps first, what I would like us to talk about is, well, in general, is like feel free. You can, it's either Joan or Marta who can respond to my questions in general. But for starters, I would like you, Joan, to start because you are visibly older and more experienced. So I'm very interested to know what's your story with psychedelics. I can imagine that a couple of years ago, it wasn't as easy to work with psychedelic treatment. So I would like you to tell me, how did you come to work as a psychedelic therapist? How did it start and what was your adventure and how did you arrive at where you're at today?
Well, that's a very long story, not only 2 years or something like that, but much older. In fact, it might be anecdotal in some way, but I began my medical studies in 1968, so that's quite a long time ago.
Mm-hmm.
And I was 17 years old when I began, and as my father was a professor at the medical school in Barcelona, he told me, well, come around the department and so you can begin to be familiar with the patient and all that. So I went there. It was the October 68, and I was charged to give every morning a pill for a patient or a woman that had depression. So I was giving every morning this pill to this person, and well, I found out that this pill was a psilocybin. So at this time, in Spain and all over Europe and the States, psilocybin, LSD were legal, perfectly legal, and Sandoz, the pharmaceutical laboratory, was giving to any patient, any psychiatrist interested in using these kind of drugs freely. And so in Barcelona, at the medical school, they had LSD, psilocybin, and they were beginning to give to their patients to see what will be the effects, the therapeutic effects. They didn't know, so it was something unknown. So they were just giving like that without really knowing what they were doing. So it was very different from now. Now it's very controlled situation, and the research is done with very strict rules, double-blind, control groups, and this methodology, which is what should be done, of course. But at this time, they were just trying to see what happened. No, so I was charged as a young student just to give this. I wasn't really involved in that whole research. But after all these years, I myself, I'm amazed not that I had this first contact with this kind of drugs so young and without really knowing what I was doing. I think it was 10 milligrams of psilocybin in tablets. And in this case, I was seeing this patient every morning. It didn't work very well. Every morning she told me, no, I don't feel anything special. And the curious thing is that when after the Christmas vacation time, the holiday, I returned to the medical school in January, and they told me, well, forget about this. This is over. This experiment is not going to continue. And of course, it was because from the States, everywhere, there was a change. These kind of drugs, of these kind of products, psychedelic products, were forbidden, and we began this very long period of forgetting about this, and it was really considered illegal substances that had no medical value, and they were very addictive, which is false. They had a real medical value. We are now checking this, and they were not addictive. They are not addictive. So, but at this time, the States, they were really worried about the way LSD especially was running around the universities. So Nixon and the CIA and the FBI, whatever, they decided to cut this abruptly, and it was a shame, but it has been like that for more than 50 years. But this is my first contact with this kind of substances. But, I remained interested on that. In fact, I published a small article in 1975 when I finished my medical studies about the hallucinogenic drugs between the Aztec people from Mexico. This was a very old use of different substances in Mexico by the tribes there. And in 1971, in fact, while I was a student, I had the opportunity to take LSD for the first time. I was 20 years old, and for me it was a revealing experience, a really, as they call it now, a peak experience, having this LSD experience. And for me it was, this time it was not possible to use it in a medical setting, but I remain interested in this kind of products. And little by little, from time to time, when it was possible, I took LSD several times and other substances, psilocybin as well. Later in 1977, I traveled to Mexico and went to Huatla de Jimenez, which is the village where Maria Sabina, a very famous shaman woman, was living. And I took the honguitos, that's the way the indigenous people call the fungi, and that contained psilocybin. It was also a very nice experience, very interesting. So I would say that since my early age, I have been interested in these substances. So I'm happy now that I can work in a legal way, at least with ketamine, and I hope that in the future, maybe we will have more opportunities to work with MDMA, with psilocybin, and other substances that might come to the market in a free way. So that's my.
Okay, very fascinating. And can you tell me, so what's the legal status of psychedelics in Spain now, or in Catalonia?
In Spain now, Catalonia have to follow the Spanish law.
Okay.
We have ketamine available. You know that ketamine is, in fact, is an anesthetic substance that had been used for more than 60 years everywhere. It's a very safe and good product as an anesthetic, and it was discovered later that it could be also used as an antidepressant for severe case of depression. And in these last years, there are big amount of publications saying, confirming that it's a product very interesting to treat severe depression. And in Spain, since 3 years more or less, it's legal to use ketamine, not as an anesthetic as this usual motivation, but as an antidepressant in what we call an off-label indication. Off-label means that a drug can be used, a medication can be used in a different way from what it was supposedly meant for, like, I don't know, this happens in many drugs, so like some anti-epileptics, for instance, are used in psychiatry, not for epilepsy, but for depression or for other reasons. Mm-hmm. And it's an accepted way, you can say off-label, but it's legal. So we are using ketamine, not as an anesthetic in our clinic, but as an antidepressant. And it's quite successful, I would say, to make things short.
Okay, and what about psilocybin or MDMA? Are they legal in Spain or?
Not yet. We hope that they will be well over the world. You know, in Australia, it's July the 1st, from this past year, it's legal. And in some states in the United States of America, Colorado, in Arizona, I think. A couple of states where it's legal to use MDMA and psilocybin. Well,
mm-hmm. There's off-label compassionate use. It's not officially legal, but in certain cases they permit the use for this scheme that's for patients that have tried many other treatments and nothing works. They can act as last resort treatments.
Okay. Marta, could you tell me, how did you become to work with psychedelics?
Well, my story is not as long. So really, when I was young, I always was interested in this kind of altered states of minds, on non-ordinary states of mind. I think I read a lot about it. I remember Huxley's, I think it's believed that it's called The Doors to Perception, which it's an essay he wrote, which I found really interesting, about his own experience with LSD and other substances. And I read a lot about indigenous use of ayahuasca, etc. So I was really curious about all these substances from a young age. And I had also read a lot about the studies done in the 50s that showed really good results. And I was kind of frustrated at them not existing anymore, these kind of studies and interest in psychedelics. So I think as soon as I left home when I was 18, I started looking for these substances to try myself. And I remember, when I was 18 and I left home, that year I tried MDMA and psilocybin a few times. And honestly, the experience for me was quite eye-opening. Maybe not so much life-changing, but it really helped me develop, I think, into the person I am today, and gain new perspectives and insights into myself and into other people as well. It really helped me connect with other people and with nature, which is beautiful benefit psychedelics can have as well. And fortunately, these two were not connected, but I had started studying psychology. So since I started my degree, I've also been studying any new research that comes out, any new study. And how I ended up here in this clinic actually has been quite fortunate. I did my master's in neuropsychology here in Catalonia, and by a miracle's chance, I don't know, I ended up doing my internship with ICERS, which is a foundation here that studies psychedelic plants. They do really good work. They don't just study psychological effects. They also do anthropology, sociological studies. They study the sustainability, contact with the indigenous people that use these substances. So they do really good work.
Okay.
And with them, I did a couple studies in for cannabis, actually, under Jose Carlos Bozo, who's a very well-known researcher here in Spain, who also really did some of the first MDMA studies in Spain in the 50s, but unfortunately the state shut them down. But yeah, managed to do the internship with them, and through them I ended up in this Clínica Sinaptica doing psychotherapy with ketamine, which has been a really beautiful way to end up here. Yeah.
Okay, thank you. Could any of you, I don't know who wants to answer this question, but I would like you to explain exactly what do we mean when we talk about psychedelics? What are psychedelics? What's the definition of these drugs?
Well, psychedelics are psychoactive substances that produce what we call a modified state of consciousness. And that means, it's hard to define really, because there are changes in perception, visual or any kind of perceptive aspects. There are changes in the way we feel our ambience. There are changes in cognition, I would say. There are changes in many aspects that are not easy sometimes to really explain how. That's why we call that there is a part of always from these psychedelic experiences that it's hard to express in words. There are something that goes beyond words, and it's very difficult to really explain this experience. So I think the best way is to experience oneself. Of course, that's the only way to really know what is a psychedelic experience. And but some people are reluctant to try this. They are afraid they might lose control. They might get crazy, something like that. And of course, it's not a question of giving these kind of substances to everybody anytime. It has to be regulated in some way and controlled. And I think it's good to have the sense that these substances are going to induce a heavy temporary change in your mind and the way you see things and the way you see your own life, the way you see your relationship, your family, your friend, or whoever. So it's good to do it in some controlled way, at least not to be alone, to have somebody at your side, after we can talk about set and setting, which is a very important part of these kind of experiences. So your expectations, the way you want to know this, what expenses you have, that would be the set, the personal set, your personality, if you have some kind of mental problem or not, and then the setting, no? So the situation where this is going to happen, will you be at home, in a clinic, in a therapeutic ambience, or you will be just a night life, having some fun or trying to have some fun with that, which is, not always the best way. So it's very important, to have the idea that these psychedelic substances are very powerful. The trip might be last 4 or 5 hours, or even more, 6-7 hours, with ibogaine even 12 hours. So you have to know what you're going to feel, and I think it's best to be in an adequate setting with somebody that you have trust, and that's the way it can be a very good experience. Otherwise, it can turn in a not very good experience.
Yeah, I think it's important to underline that indeed, like, it is important. How are you going to go about taking some psychedelic substances? And do you, because I have a problem with, for example, classifying whether MDMA and ketamine is just as much as of a psychedelic as, for example, psilocybin and LSD, because it seems that there is like a bigger or smaller amount of control that you may have over what's happening when you're taking this kind of drug. So I don't know. Could you tell me, what do you think? Is MDMA also considered a psychedelic? Is ketamine a psychedelic? Does this feeling of control really play a role? Is it in fact true that you have a certain amount of control with different drugs? It may differ.
I think psychedelics, it depends on who you ask. If they would put MDMA into this category, it can be a very broad definition or a very specific definition. For me, I think I would classify MDMA and any other substances like salvia and mescaline, obviously, other things like this, all as psychedelics, because they do cause like a non-ordinary state of mind, whether it be visual or more mental, in the way you feel towards each other, towards yourself, etc. I think I wouldn't place them in a spectrum, but I would say they're all very different types of psychedelics. Ketamine can be it's a very intense psychedelic as well, but in the way it feels is very different from psilocybin or LSD. And I think the aspect of control plays a part, but in all of these substances. So especially through experience, you can gain control over many aspects of the trip or the experience. But especially at first, when you start trying these substances, it does feel a bit like you can't kind of guide your experience. But it's never, unless, in most cases, unless you take a very big amount or you have a lot of or other factors, like, set and setting, you have a lot of fear. In most situations, you will never lose control and it won't be as intense as many people expect it to be.
Okay.
Maybe on this, if I can add something, there is a long-standing polemic about cannabis, because cannabis, I think I am convinced that cannabis is also a psychedelic, but it's so widely used and in a different way, even if there is the therapeutic cannabis as well. But in psychiatric psychedelic psychiatry, usually we don't consider cannabis, but for its effects, it can be really powerful. Of course, depends on the dosage. There are very light doses that can produce, some kind of effect, but really low. But cannabis in enough dose, a sufficient dose, can be very, very powerful and can act as a psychedelic as well. Can spend whole afternoon in a trip produced by cannabis as well.
Does it depend on a dosage? Like, how much of cannabis would you take in?
Of course, yes. There's a dosage problem and also personal problem. With any kind of substance, the individual response, it's something amazing. Sometimes a very big person having, 120 kilos might be very sensitive to a very low dose. And instead, a person that doesn't weigh much, like, 45 kilograms, might have, on the contrary, the need of a very heavy dose. So the weight is one way of knowing more or less the necessary dose, but it's not the only factor. There are these individual factors that we don't know in depth, and so you have to try and see what is convenient for each person.
The cannabis, it will be also the proportion of THC versus CBD. THC is much more psychoactive than CBD. It depends on the variety that you're consuming.
Yeah. So tell me, in your clinic, you offer treatment with ketamine. Do you also offer treatment with cannabis or other kind of substances, or for now it's only ketamine?
Right now, we only offer ketamine treatment, as I told you, in an off-label mode. And but we hope that if MDMA, as they say, it's going to be legalized maybe this year or next year. So in the future, yes, we intend to use all the legal possibilities to use MDMA or psilocybin as well. We we think that this will be the two substances that will be legalized little by little all over the world, probably. Maybe in the future, other substances as well. So
Cannabis, hopefully, as well, which is not really medically legal in Spain yet, although it's used in some contexts.
So could you tell me in what consists ketamine treatment? So do you only treat depression with ketamine? Are there some other mental disorders that you use ketamine treatment for? And how do you decide whether someone should use this method or not? And then, like, eventually, what does it consist in? So do you take ketamine on each meeting, or do you take it at home, or what's the procedure?
So here we use so far only ketamine, as I told you. And here at the clinic, we don't make treatments outside of the clinic. And we have a design which is not ours, but from Phil Wolfson, which is an American psychiatrist that had been working with ketamine for years and has written a very interesting book called Ketamine Papers, and other authors as well. And usually we treat mostly depression. We think this is the main indication, what we call even resistant depression. So this kind of depression that has not responded, that has not getting better with antidepressants. We have here patients that have been taking maybe 10, 15 different antidepressants and they don't get better. So this would be, I'm not going to say the last solution, but one possibility to really recover has been proven for some really severe depressive patients that are sometimes on the verge of suicide, some suicidal thoughts. And it works mostly for depression. But we have had also other psychiatric diagnoses like severe anxiety problems, obsessive compulsive disorder, some bipolar patients even. But you have to screen very well the patient. So it's not just coming here and having this treatment, but we have, of course, our screening method through an interview to see if it's really adequate to use ketamine in this patient. And ketamine also can work for chronic pain. It has been proven that can get good results for chronic pain, and some other indications that we are trying to be aware, like
addiction. There's quite a few studies coming out now with alcohol use disorder that have very good results. Some with cocaine have also been used, and even opioids. And post-traumatic stress disorder, there's some very good results. And I think quite a few other things as well.
So then when you do think that someone is, that you should use this kind of treatment for a patient that comes over, so you do the screening procedure and you decide that ketamine treatment is in fact what would help this patient, then does he take ketamine only once, or does he repeat the sessions with ketamine? How does it work?
The usual scheme would be to schedule 6 or 8 sessions with ketamine, for instance, twice a week, but it can be once a week as well, or in some cases 3 times a week. But well, the most common schedule would be twice a week. And of course, as well with the integration sessions that in between, that means that after maybe 2, 3, 4 sessions with ketamine, we schedule a talking session. This is the integration sessions, to go deep into the process of this patient, to know exactly what has been being changed or not. How is the response in general of each patient through these added sessions of integration. So the usual schedule, as I told you, was making 8 sessions. That means 1 month, more or less. And in some cases, we have to repeat after a period of maybe several weeks or several months, some other sessions. But we are learning this because it is a new thing. We know some indications, but we have to work more on that and discover what would be the best way to administer the ketamine. Usually, yes, we can say that it will be from 6 to 8 sessions of ketamine, and therapy that's always accompanying ketamine.
There's a psychotherapy aspect within each ketamine session as well. Like they last about 2.5 hours, and there's a integration. So after administering the ketamine, they have some time with music and an eye mask on. And then within that same session, we also do have an additional hour of integration. I'm talking about the experience, what they felt, what they clicked.
So if they have the mask on and they have some music, then it's really more of a journey inward. Am I correct? Because from what I've heard, for example, in MDMA treatments, you might have those sessions where it's really outward. So you're asked to talk while you're impacted by the drug. So could you perhaps tell me what's the difference? Like, why do you, for example, choose to use a drug that would allow you to go inward versus a drug that will allow you to go outward and to really talk while you're on the drug? Could you perhaps elaborate a bit on this difference between different kinds of protocols?
Yeah. Well, myself, I would like to say that I prefer to leave the patient a little in his inward trip, I would say. But of course, if we are there for any possibility, and some patients are really more open to explain and to ask, and they want a little this combination of inward and outward work. But it's a very individual response, so I cannot say I'm going to work inward or outward, but I don't know, Marta, how do you see this?
I think with MDMA, it's also quite possible to leave the patient for an hour or so with music, introspection, etc. But MDMA is a special type of drug in that it really increases empathy and this want to connect with others, and it facilitates speaking much more than any other substance. That's why it's so indicated for PTSD, because it really helps talking, and you can, with trauma, it helps you access these traumatic events and experiences, being able to talk about them without triggering this fear response that people usually get outside of the therapy sessions. So it's super useful in these cases because it, through allowing you to explore this trauma in this altered state of being, it extinguishes the fear response that you usually get outside of the sessions. So this dissociation and these symptoms you get from the trauma kind of eventually disappear through use of MDMA. But ketamine and other substances are not so... they do increase empathy a little bit, but it's not as much. And it really facilitates introspection, because your state of mind and your corporal feeling even will be so different that I think most people will actually prefer to just be quiet, listen to music, and go within for a little while. Maybe not the whole experience, but for a little bit, it's much easier to go within than outside.
Okay. Is it the participants who choose the music, or do you have is it always the same music? How does it work?
Well, usually you have already some prepared playlists that we have been quite carefully preparing, so it's not anything works. No, it's we try to elaborate this playlist. Of course, with ketamine, because of the trip itself, it's shorter, about 1 hour, I would say. The playlist is more limited in time. For psilocybin, if the session might last for 5-6 hours or even more sometimes, so we need a longer playlist. But the playlist also has to take into account the beginning, a more light kind of music, little by little, as the patient goes into more deep layers of his consciousness in some way, so the trip is more profound. The music also is different, more, I don't know how to say it, more, try to be abstract in some way and trying to help the people to get into his or her depths. And of course, there is a lot of discussion about this kind of playlist. And I remember in the beginning, the Johns Hopkins University in the States, they were one of the pioneers in that field. They elaborate some playlists that are, well, can obtain easily in internet. And maybe after so many years of experience, we think that there are some things that would be better. So we have been elaborating different playlists. And at the same time, some patients, well, they say, no, I have my own playlist. I want to listen to my own playlist. Sometimes there is a discussion about this, but I understand that music, of course, musical gusto,
taste
is a very individual thing. So you have to respect the other point the musical taste of each patient, no? But there are some kind of rules, like saying, music with lyrics, with words is not good because words might evoke things that not important to evoke, for instance. So it's better more abstract music, like electronic music sometimes. But myself, for instance, I think that classical music, especially not romantic one, but more Baroque, like Bach, like this kind of
organized
middle-aged music or Renaissance music might be very adequate because they are very soft and at the same time very deep. I really like this kind of music for myself, at least. And for patients, well, of course, you have to respect different musical tastes, and it's not easy sometimes to really find the more adequate music.
If they want to bring a playlist, I always let them put on their own music. In my experience, lots of people have brought really good playlists. I approve. Some people bring playlists of music that they listen to a lot, and they themselves find that listening to very familiar music kind of takes away from the experience because they feel maybe their altered state of consciousness is not so different when they listen to music that they listen to every day. What is very clear, though, is that music is a very, very, very big part of the experience. It kind of leads the whole trip. And really, it's key to the experience in the way that even, the kind of music that you play is going to make a big impact. So some people, depending on their state, some people require very calm music, and this will transmit a very peaceful and kind of zen state of mind. But we've had patients that tell us that using more intense music, it depends on the song, but maybe drums, maybe something that kind of awakens a bit more emotion, is really beneficial for the therapy as well, because they help them connect with certain aspects of their inner world, their memories, etc., that they wouldn't be able to connect with if the music didn't have this kind of intense aspect to it.
The reason I ask that is because I find it fascinating that music plays such a huge part in those psychedelic experiences, and I'm very curious as to why that is. And also I wonder, it's just my personal thought, whether music itself has also perhaps some of the power that's brought by psychedelics. It is a facilitator, but then, for instance, we know also that certain breathing patterns can also change your consciousness. So really introduce this altered state of consciousness. So it would be also, I don't know, maybe it's already done actually, but it would be also interesting to see whether, for example, certain kinds of music together with certain breathing patterns, they would have a similar effect or maybe a completely different effect to what's being offered by the psychedelic drugs. So that's just
would be a good combo to try. I'm sure people have done it out there. And
hey, if you're still listening, that means that you enjoy this podcast. We love sharing with you, speaking with our guests, and we are happy to bring all this information to you for free. However, if you like what we're doing and you wish to support our work so that we may keep developing this project, visit our website, hhpodcast.buzzsprout.com, and click the support button to make a donation. You can also follow us on Instagram or subscribe us on YouTube. And don't forget to share our podcast to a friend or a family member if you like it. All the links are available in the description of this episode. And now, back to our conversation. I wanted also to ask you whether you observe any kind of similar patterns in what is being experienced by people who undergo ketamine treatment. Is it really very individual, or can you somehow distinguish what's happening? Like maybe they see some images, maybe it's often related to your family, maybe it's often related to, I don't know, and like some kind of a personality trait. Is there something that can be a universal pattern, or is it really just a very individual experience?
Before let Marta answer this, let me add just about music. That music is so powerful, so the emotional level, that, there is music therapy as well for years that has been existing, and it works very well for different ages, different pathologies. So it's really a very good work can be done with music. And for instance, that people with Alzheimer that are completely lost, they recognize anybody in the family, they cannot even speak almost, and you put some music that reminds them from their youth, and they begin to sing, to dance. So with music, you can really reach very special levels of our consciousness.
Yeah.
And I leave Marta answer.
Yeah, in regards to patterns, it's very difficult to say. It is, I would say, it is very individual. There's certain ways to respond to ketamine that we do perceive here, but it varies a lot. So some people have very, like I said, some people have very quiet sessions. They don't have a lot of visual effects or really like a lot of mental imagery going on. Some people do connect with memories and people a lot, so they do actually see, relive some memories or see people. We've had some cases dealing with grief after losing someone, where they actually see the person they lost and they even have a conversation. But there's really like a very, very big range of ways to respond to the medication. And in response after the sessions, for me, what's most remarkable is that ketamine doesn't usually give you a feeling of euphoria or like really feeling excessive happy. It's more what we most commonly see is more a feeling of peace, of having a calm mind. There are people who have very anxious and obsessive thoughts. They kind of find this mental clarity and peaceful feeling that they can almost never access, which is quite beautiful to see.
Do you think that these effects of psychedelics can also be implemented, can also be observed if we take psychedelic drugs recreationally?
Well, it's a possibility, of course. Recreationally means not forcefully.
Not in a clinical setting, yeah.
I think it's always a human experience, a very deep human experience. So for some people, maybe they don't have this therapeutic idea forcefully, but it's always helpful. And because of the intensity of the experience, I think maybe some people think I'm going to take it as a recreational tool, but then they realize that it goes really deep into oneself, and it changes this initial way of taking the substance, and can be very meaningful and change. I'm not going to say it's going to change your life, but in some way, sometimes it can change your life. A very deep psychedelic experience that you expected just to have fun. So it goes beyond this.
Yeah, I think a lot of people talk about intention when taking psychedelics, about setting an intention. And I think it would have a big impact on the experience and what you learn from it. But I also think that definitely without setting an intention and just aiming to have fun, to have a good time, you can also get a lot of learning from the experience and of growth. And I think also, like, my hope for the future is that when these substances become destigmatized and they can become more accepted, and people will kind of grow up knowing about these substances and kind of accepting them in society, and will kind of integrate, hopefully, people will integrate this tool that we have access to and kind of be able to use it whenever they feel the need to, without even going to a psychologist or a therapist specifically, but using it in a way that's for personal growth outside of this kind of system that we have right now, no?
Yeah, I think that, yeah.
No, it's a very delicate point, and it's polemic, of course, because you have to be very careful. You have to think that most of these substances come from holy plants that have been considered like that for centuries in different tribes in the Amazonia or in Mexico, in Africa, in Asia, many countries. There are different people that have this knowledge, traditional knowledge, for centuries or even maybe thousands of years. So we have to be very respectful, I think, that, not so respectful these plants, and at the same time with the people that might take these. So this recreational use, well, I understand it. I think it's not good maybe to reserve this to the psychiatry, psychologist, and some people might say, well, I want to have this experience and I'm not a patient, and I understand this. But it have respect for me is a word that has to be reminded.
Well, that's what I think also, like, if we do kind of accept it and integrate it into society, I think that would go along with it. No, it's about learning to know the substance, to respect it, and know its power, but without the fear that's very common nowadays, no? Because I think this fear creates the stigma and also the bad experiences, no? A lot of people try these substances out of curiosity, but at the same time, they have so much fear of what's going to happen when they consume it that then they have a bad trip or a bad experience, no? So this integrating these substances into society is learning to respect them, but also kind of knowing the facts, no? How they work and in what situations to take them, what setting, what mindset, etc.
Yeah. And then if, for example, someone does decide to take it recreationally, but like in a conscious way, just like, I want to have this kind of experience, so I take psilocybin or another kind of substance. Do you think that this person should also consult a therapist afterwards in order to move on to this integration part? Or do you think that it's not always necessary? Because if you should consult someone, then like, how do you find someone who can help you if, for example, psilocybin is still illegal in many places? What do you think?
I think it's not a compulsory thing to consult a psychologist or a therapist after the experience. It depends on the effect of the experience itself. If it has been in some way a disturbance for you, or in some way has evoked important problems that you might have and you didn't realize before, then yes, it's a good thing to consult some expert. But you can have a personal experience that might be always also important and show you something and learn to something about yourself. But there are, any possibility can be good.
Finding someone that can integrate, I don't think it's always necessary, but if you do have an intense experience, it can be useful. It's finding someone can be difficult. I would always recommend finding someone that's also tried it. I think for the therapist to have had personal experience with psychedelics as well is a very important factor, because it's very difficult to understand what they've been through if you haven't tried it yourself. I think that would be one key aspect to look for.
Okay. And then, because we've mentioned the taboo surrounding psychedelics, where do you think it came from? So why in the beginning, why was it delegalized in the 70s? And then where do you think the taboo comes from related to the use of psychedelics?
Well, in the 70s, it was illegalized because the power, the political power, were afraid of what was going on. No? That I lived this period in the 60s when we had news that in the United States, in all the university students were taking LSD, and there was an ambience of really something is going on. There were the hippie times, and there was a sort of revolution, I would say, a cultural revolution there, mixing a political problem with social problems, with religious problems, or very individual problems. And as I told you before, the president at this time, Richard Nixon, was a very conservative person, and all the main power in the states. So these as they were afraid that there was going to be a sort of revolution. So they decided to cut this in a very abrupt way and a very inadequate way, of course. I don't. The second part of your question.
Yeah, but like then, so why did the other countries follow? Because the United States said that drugs are illegal because they were conservative. So why did the other countries follow? And then, so it's illegal, but do you think that just because it's illegal, the taboo arises? Because, we don't want it because it's illegal. Because, for example, we can see the history. There were times that alcohol was illegal, but still people managed to consume it, and it wasn't. I don't think they were perceived as criminals. Whereas today, very often, when someone says that he takes drugs, different kinds, it's somehow looked at as as if you're a criminal or as if you're doing something that's morally bad. So I wonder, where does it come from? Do you have any ideas?
Well, this is a very interesting the history of the humanity. Humanity has always been aware that some substances produce some kind of effects that might be, interesting or very agreeable effects. And so the history of humanity is the history of drugs. And not only humanity, but you know that many animals also discover that some products, some vegetables, some fruits, some different herbs or whatever have this psychedelic effect. And we know that many species of animals also are drug consumers because they enjoy the effect they have eating mushrooms or eating whatever they know that will produce this effect. And for you mentioned, yes, this how the United States managed to have this universal prohibition. Well, because they intervene in the United Nations, in the World Health Organization, and they invented this called List 1. I was I don't know how they call it, estupefacientes. Some substances, as I told you, are declared they are non-useful for medical questions, and at the same time they are addictive. This was not based on any scientific discover, but it was invented, this kind of List 1, and many of these psychedelic substances were included in this list in an unfair way, in an unscientific way, but the United States managed to have the whole world convinced that it was true.
Hi. Yes, sorry.
Now there is, the so-called war on drugs has been going on for years and years, and it's a ridiculous situation because there are millions of dollars are being spent in fighting against the drugs. But, what we have being confronted is a crazy situation where the big mafia drugs are really more powerful than ever, and the consumption of drugs is all over the world, and it's not diminishing. On the contrary, and even you mentioned the alcohol. Well, yeah, in some countries alcohol might be forbidden, but it's also consumed, and there is a tendency, a human tendency to to consume drugs, and we have to wonder, well, how we can manage to make this that is not provoking diseases, problems, but it's a human tendency to try drugs, and this should be allowed. I think all drugs should be allowed and just controlled, make the people well informed, taking into account that at some ages it's more dangerous than in other ages. I mean that childhood, in adolescence, in young people, of course, drugs can be much more harmful than in another periods of your life.
Okay, Marta, would you like to add something?
No, I think this prohibition it came and spread through politically motivated ideas. And the fear itself has spread because people always get some of the worst stories that occur now, some of the worst experiences with acid, for example, or other cases that do happen. They can happen. Usually, many times it's mixed with other substances. For example, alcohol and psychedelics cause a lot of trouble. And then this story spread, and obviously there's a lot of misinformation out there. No, a lot of people who I talk with, I find very surprising that they have completely crazy ideas of how psychedelics will affect them. Even doctors nowadays and other therapists, like today we had someone tell us that their psychiatrist recommended against trying ketamine because for him it was something that was completely out of the ordinary, and despite there being already so much evidence for the use of ketamine. So yeah, I think there's a lot of fear out there and people have very closed off minds sometimes with this kind of things and don't accept that it might not be the way they think it is.
Yeah, but I do think that it changes slowly, like especially for the last couple of years. I think that the research also that is being done on psychedelics shows that it has real potential. So yeah, I also hope that it will change soon. Could you tell me could you perhaps tell me what do you think about microdosing? Because it is also a concept that is very widely used. And I don't know, because there are also some people who say that it's not true, that it doesn't really work. Could you tell me what's your perspective on that subject? Maybe first, what is microdosing? Because perhaps some people will not know. And then, what do you think about the potential of this kind of method?
Well, microdosing is using these sort of psychedelic substances in a very low dose that is under the threshold of really being active. And there is this theory that you can take it every 3 days, for instance. Well, there are different ways of, But I can tell you my own story about microdosing. I tried LSD in a microdosing way for about 2 or 3 weeks. To me, it didn't work at all. So I don't want to be definite and say it doesn't work. I'm sure that for some people it seems that it works. But there are so far not really many scientific proofs that is really doing some real effect, more beyond placebo. You know that placebo effect is very important. So you will find many people convinced that the microdosing is working. There is this sort of fashion in Silicon Valley. Everybody is taking microdoses of psilocybin or LSD or whatever. To me, so far, it has not been proven that it really works, and I wouldn't recommend people to take it. If some people want and they feel it useful, of course, they can do whatever they want, but I'm not a fan of microdosing.
Okay,
it's true that was really so far. There's no evidence towards the effectiveness of microdosing beyond placebo effect. Although I have to say, like these kind of things are very hard to study. It's very subjective sometimes, very hard to quantify. I share with Joan that I have tried microdosing with psilocybin without any noticeable effects for myself. But at the same time, I have heard many personal stories of people who have tried it and have had a lot of success. I don't know if this is attributable to the dosage itself or placebo effect, obviously. But it's true that there's been a lot of people out there that microdosing has really helped them. No, so I wouldn't exactly advise against it. If someone wants to try, in the end, you're taking an amount which is not psychoactively, it's not active psychologically. So it either has a positive impact or it does nothing at all. So I see no harm in trying. No, so it has helped a lot of people.
And what can it help with what can it help you? So it can help you with depression, or with energy. What benefit can it bring you?
Well, with microdosing, it's more subtle. I think they say, well, it just helped me, not for real depression. I don't think prove that it's going to work, but just to feel, well, more ready to work, to be more creative. Creativity, especially, yes, but not much more. I don't know. Really.
Yeah, most of what I've heard is for anxiety, it can work. Creativity, energy levels, I've also heard it has impacted, and I don't know if clinical depression, like severe clinical depression, it would have a big impact, but theoretically, I mean, not theoretically, but anecdotally, it has had an impact.
Okay. And also one perhaps of the, we're going to finish our conversation soon, but there is a couple of things that I wanted to ask you about. So the first one is related to psychedelic plants like ayahuasca or DMT, because they seem to be a bit less known, I think, in the popular science, in the popular view. Could you tell me about the power of these plants? Is there a medical power to them? So is there something that we could treat with them? Or do you think that it's more really like a transformative experience that one might have? Could you tell me about the potential of these plants and about the kind of trips that you have with the use of those substances?
Well, ayahuasca, in fact, it's a mixture of plants. And the properly called ayahuasca has no psychedelic effect by itself. It's a Bacteria capi. It's a liana.
It's a vine?
A vine. It's a vine in English. And by itself, it's not psychedelic. But the interesting thing is how these Amazonian tribes that use ayahuasca found out that mixing with another plant, Psychotria that contains DMT, which is the psychedelic, really, or very powerful substance, they could manage to make the psychedelic effect by mixing these plants. Otherwise, ayahuasca itself, the vine, wouldn't produce this effect. So you can imagine that in the Amazonian area, there are 30,000 different plants or kinds of different vegetables. And how they found out that mixing these two, they could produce this effect. No? So this is the first mystery in ayahuasca. And then, yes, after this, it has been, widely used in the Amazonian, among the Amazonian tribe, and it has been also being used all over the world. Now, in Spain, we find lots of groups and people, so-called therapies or so-called shamans or whatever you can call that, are organizing these collective ceremonies because they are many times linked to some kind of religious. There are these ayahuasca religions, Santo Daime, the Vaquinha, different religions that came from Brazil and had been spreading in Europe and in the United States. So there is, by one side, this ceremonial religious use of ayahuasca. Then there is this old, ancient tribal use. Myself, I was in 92 in Ecuador, in the Amazonian area, doing research about the Shuar people. They call it Natem, ayahuasca. Every tribe has a different word, but ayahuasca has been most widely used. But for Shuar people, they were Natem. And I had the opportunity to be in several shamanic ceremonies with Natem among the Shuar tribes of Ecuador. And it's very interesting the way it has been for me. It's a sort of mystery. How come that ayahuasca has had this wide diffusion all over the world, and there are many people, Western people, that have been experiencing ayahuasca, and it's also a psychedelic tree that can be very useful for certain persons to, as well we described before, as a really good for depression or whatever mental problems you might have. And so that's one reason why ayahuasca is being so diffused right now.
Something about it that I really like is the ayahuasca, as other substances, so ibogaine as well. It has very deep links to tradition and culture, and they're used in a very communitary way. So they're used with ritual, with ceremony, and with other people there. And I think this aspect of consuming drugs with ceremony and community can be very impactful and can have itself be a factor that benefits or sometimes maybe takes away, but it can benefit the experience a lot. And I'm curious as to how it could be applied to other substances as well that don't have this tradition. No, for example, ketamine, it could be done in a group setting with like low doses, and it might facilitate some different experiences as well that could be beneficial.
Yeah, very interesting. And do you think about trying that perhaps in your clinic to introduce this kind of group setting for ketamine treatment? Have you ever thought about that?
Not we don't have plans so far to do this, but who knows, in the future maybe we can talk about and design some kind of ceremonial or collective. But I'm not a very well, I don't think much about collective ceremonies. I think that psychedelic drugs are better used in a quite restricted way for one person, maybe two. But collectively, I don't like this approach. But well.
And what do you think about the use of psychedelics for couples therapy?
Well, especially for with MDMA, it seems to be very, very good technique because, as Marta was saying before, MDMA has this possibility of making people more, empathetic, and this, of course, in a therapy process, can be very useful for not only therapy couple, but all kinds of therapies. So, it's more prone to be used for a collective, short collective, I would say, but in a collective way, probably.
Okay, Marta?
Yeah, I think especially MDMA, it's for couples therapy could be absolutely groundbreaking. To be honest, it facilitates communication. It can be life-changing for a lot of people. Other substances, maybe not so much, because it would be more introspective. For group settings, I think low doses could be really interesting. For example, giving lower doses than we give right now with ketamine could be very interesting to explore in a group or even a couples therapy. But it's a new ground, so there has to be a lot of investigation there and seeing how it goes.
Yeah, I was curious because I know that when you have like an ayahuasca ceremony, for example, that very often when you take that drug, it starts with the purification of your body, which means very often that you would vomit. How do you explain it? Like, because I think that personally, like if I would vomit, I would be very terrified of that fragment of my experience. Could you perhaps explain to me, why do you think that is this purification really important? Is this like really a step that is crucial for like the rest of your experience? Where does it come from physiologically? Is it I don't know, like a reaction for why does our body react this way to this kind of substance?
I think there is a physical, chemical explanation for this. These plants. They have many different substances. It's not only that it has DMT and email substances. No, there are hundreds of substances probably. And well, the way it is prepared, it provokes to almost to everybody this kind of vomiting reaction and things like that. I have been in several ayahuasca sessions, and yes, I also had this reaction. And particularly, I don't like it. So I'm not going to repeat with ayahuasca because after my half a dozen experiences, I had enough, and I don't want. I prefer psilocybin or whatever. But for some people, they give also this more than physical reaction, and they feel it as almost a spiritual thing that you are vomiting and you are putting outside yourself bad things or whatever. And there are some kind of almost religious explanations for this, but this purgative aspect, to me, it's not necessary to have a good psychedelic experience that you can have with other substances than ayahuasca. But of course, this is a very personal opinion. So.
Personally, I agree. I think that vomiting is a physiological reaction, and just the purifying aspect to it is a narrative we choose to give the experience. No, in the end, it feels much better to say I'm detoxing. I'm getting rid of all the bad experiences within me to start again and renew myself. No, it's just a narrative that's very helpful. But in the end, I think it's a physiological reaction that's not really necessary for the experience.
Okay. So we've talked about the medical potential of psychedelic drugs and about the transformative potential of psychedelic drugs. And one last thing I would like to ask you about is the potential of psychedelic drugs in research. What kind of aspects of human psyche can we research with use of psychedelics? Is it something that interests you also personally?
There's a lot that you can study with these altered states of minds. Something with ketamine that's quite interesting is they say it's the nearest you can get to a near death experience. Ketamine, no other psychedelics is as similar as ketamine. So this NDEs, you can have a near death event, which is the experience of being near death, but without the near-death experience. The near-death experience is a very special thing that happens in these events where they're very characterized by dissociation, which is why it's similar to ketamine, like out-of-body experiences where you kind of maybe see yourself from outside, very mystical, spiritual experiences. And there has been a few studies with ketamine about this, and there's a scale that's used to kind of try to quantify this experience, and ketamine is the drug that most approximates this state of mind. And near-death experiences are linked to so many different benefits of well-being, of kind of reevaluating your life, finding meaning in life, and lots of existential questions about your responsibility, your freedom, the choices that you make day to day. So really powerful experience, really.
And also LSD and psilocybin can provoke these kind of experiences. This very famous Czech origin psychiatrist, Dr. Stephen Grof, has written a lot about this kind of sensations. And so it's near death, rebirthing, all some sort of categories, always getting into mystical states and very deep religious, call it mystical or whatever. And for Professor Grof, it's a really good experience to have this, and it might help a lot people with severe mental problems.
And a sense of connectedness is also very common, which can be very powerful as well. This kind of being one with the universe, with nature, with others.
Yeah.
Very good.
Yeah. Okay. Well, there's a lot of interesting things to know. There's, I think, a lot of potential research to be done and potential other uses of psychedelic drugs. So I'm looking forward to exploring them in my life. So thank you very much for this conversation. I learned a lot. I'm sure our listeners will also learn a lot. And keep up your work at Clínica Sinàptica in Barcelona, and we'll stay in touch. Thank you very much.
Thank you for having us.